Good evening, everyone. We are here with yet another session. Today, here we are with Dr. Swetharani, who has completed BNYS from SDM College of Yoga and Naturopathic. And she is currently practicing as a yoga instructor in the field of maternity, diet consultation, wellness coach, and she is also acupuncturist. And she also had experience of Zumba certification or Zumba instructor. And she also teach in the period of pregnancy, the kind of yoga, diet, and all kind of management she provides from the naturopathy. And with this small introduction, I would like to welcome Dr. Swetharani on our platform OYG. Thank you so much to come on our platform.
Okay, good morning, everyone. So thanks for the introduction. So I'm Dr. Swetharani here. So we are going to learn few prenatal yoga asanas and few exercises and few guidelines and all for the pregnant ladies. So let's get into the session. So I'll be sharing you the slide now. Okay, so in prenatal yoga session, first we are going to talk about the importance of yoga during pregnancy. So why we need to practice yoga during pregnancy? So what is it necessary to do? So there are two types in that. First is before conception and during pregnancy. So before conception, why we need to go for the practice? Because most of the pregnant ladies will be so much fear, they'll be having so much anxious about pregnancy and delivery and all. And some people might also have fear during the pregnancy period. So how will be my pregnancy period? So will I have to suffer more? So there'll be little fear and anxious about the pregnancy period, right? So for that only we are going to practice yoga before the conception. Yeah, we need to start yoga before the conception. So before conception, we need to go for more of a hip opening asanas for the good fertile period. And so in before conception, we need to make a woman for a good environment to stay for the baby, right? The baby need a good environment. It can't live in a negative environment. The baby has to grow in a positive environment. So the women should be positive inside and out so that the baby grows well. So before conception, the women, the yoga makes the women more physically, emotionally, and spiritually stable. And also it creates a positive environment for the baby, as I said, and it promotes physical and mental health and increases the pranic level and vitality and gives you more energy so that the people will not get more exhausted. So those are the things during you need to practice before conception. And once you get conceived, for the first trimester, that is the first 3 weeks, you need to stop more of physical activity. You can go for the breathing exercises, pranayama and all, which we'll see in the further session. And during yoga, what are the benefits? First is physical benefits, and second one is emotional and spiritual benefits. In physical benefits, there are a lot. It gives a good flexibility for the women. It gives it tones all the muscles in their body so that they won't get so much strained or they will not get so much stressed and all. And one thing you need to remember, they can't go for a deeper stretch or a strainful practice, something like that, because during pregnancy there is a hormone called relaxin that will be secreted in your body, so that when you tend to go for a deeper stretch in any asana, so the relaxin hormone will be secreted more. So you tend to go for a deeper stretch so that you might injure your ligament, your bone, or your organs. So it will be easy for them, but because of the relaxin hormone in your body, you might injure yourself. You might have a ligament tear when you go for a strainful practice and all. So that we need to take care. And in physical level, it helps to stabilize and strengthen the muscles of the spine mainly, because during pregnancy, they'll be putting more weight on their lower parts of their body, in the lower abdomen, so that they need to support the lower abdomen. So some people might push the abdomen forward so that they will have a backward arch in their spine. So that gives a more pressure in their lower back muscles. So the lower back muscles gets more stiffened. So they need to practice yoga. They need to stretch the lower muscles, that is quadratus lumborum, regularly to gain a good health for their spine. So mainly it will strengthen the spine if they keep on practicing daily, and it increases oxygen level for both the mother and the baby, and it improves general fitness for the mother, and it improves good circulation and strengthens the heart, and and it can prevent any fluid retention. When you go for any movement in the legs, it will not the body will not help you to retain any fluid in your body. So many pregnancy ladies, they will be having pedal edema, that is the edema in the ankle region, and the fluid accumulation will be there. So to reduce that, you need to have some movement, right? If you keep on sitting or if your leg is hanging, you pregnancy ladies might get. So they need to go for a physical activity and to prevent that. And mainly, it will help you to prevent more of heat in their body, because when you go for practice of yoga, many tend to increase heat in their body, but we are going for a yoga which cools down their body during the pregnancy period. Then you should not go for the practice of Surya Namaskara mainly, because Surya Namaskara will increase heat in your body, so that may cause so many troubles. And also in pranayama, also they should not practice any heating pranayamas. Pregnant ladies mainly should not practice anything that is making the body heat. They should not eat something that is making their body heat, and they should not take only cold foods. It should be a balance. There should be a balance between hot and cold food. And next we are moving on to spiritual and emotional stability. So mainly the spiritual and emotional stability gives them free of mind, so that the thought process and all everything will be reduced for the mother, and they will have a self-confidence, a willpower will develop, and they will be more aware of their body, so they will get to know what is happening in their body. So they tend to observe more about their body when we go for self-awareness practices and all. And for the baby will be more positive, the baby will be more peaceful. If they are practicing yoga, if they are calming down their mind regularly, the baby tends to grow in a very peaceful environment, and it will have a positive atmosphere around it. And it helps in the spiritual development of the baby also. So spiritual in the sense, it's not only related to God or something like that. Spiritual in the sense, your mind is in a calm state, like your mind is in a thoughtless state. So the baby also grows with that state. The baby doesn't want to grow in the negative state, right? So we are moving on to the next slide. So pregnancy yoga guidelines. There are few guidelines that you need to follow before going for a practice of yoga during your pregnancy. The first one is no compression, no strain or overstretching of the belly. So first thing is no compression. You should not put more compression on the belly, because that might induce your abdominal contractions. Okay, during the second and third trimester and all. And you should not strain or overstretch your belly. And also, you should not overstretch your body also, because I told you, right, the relaxin hormone will be so much high in the pregnant lady, so they might tend to injure themselves during the pregnancy. And the second one is you need to avoid forward bending asanas. So mainly why you need to avoid forward bending asanas in the sense, so during pregnancy they might have nausea, feeling, and vomiting kind of sensation and all. So when they go for forward bending, they tend to put already the belly will be already the uterus is full and the stomach is pushing upwards. So when you go for a forward bending, immediately the person has a nausea feeling and immediately they'll go for vomiting. But that will not be very comfortable for the pregnancy women, right? So for pregnant lady, we need to follow a protocol which is more comfortable for them. They need to feel more comfortable while practicing yoga. Okay, and they should also should be very energetic while practicing yoga. They should not think like, why I need to practice yoga, I want to rest. They should not think like that. They should have an interest, then only they can practice yoga. We can't force some people, right? And next is avoid holding breath in any asana. This is the very most important point in the pregnant lady protocol. During any asana, many people, we also tend to hold our breath for at least 2 seconds in any asana, right? So mainly pregnant ladies should not hold their breath in any asana. That will give a major complication to the baby and also for the mother. At least for 1 second also, they should not hold their breath in any asana. And next is avoid prone poses and inversions. So yeah, prone postures you can't practice during second and third trimester, and first trimester also you should not practice, because it will also induce the nausea sensation. And inversions are mainly contraindicated during pregnancy, but you might see some celebrities practicing inversions. Maybe they want to show off or something like that, but actually the inversions are contraindicated, because it will produce more and more complications to the baby and also the mother. And you need to avoid heating pranayamas. As I said, we need to avoid all the heating procedures for the pregnant lady, because it may induce labor also sometimes when the body is more heat and all. So these things, these are the guidelines you need to follow. But the most important thing in this guideline is you need to avoid holding breath in any asana. So we are moving on to the next session, that is prenatal care. So the importance of regular checkups with a regular healthcare provider. So once you know that you're pregnant, once you confirm yourself that you're pregnant, you need to go to a physician and you need to first go for a general checkup. So the general checkup will be first, you need to go and you need to check whether the baby is good, whether, and after some time you need to see whether the heartbeat has come, whether the position is proper. So you need to have a general checkup for the baby. So first fourth week, from 4th week to 28th week, you need to go for every 4 months. Sorry, every 4 weeks in a month. Okay, so you need to go for every 4 weeks, you need to go and regularize the checkup. Okay, from 4th to 28th, and from 28th to 36th week, you need to go for every 2 weeks once. And after the 36 to 41 weeks and all, that is a crucial period. So you need to go for the visit every week, or maybe like twice or thrice in a week also, if they have any complication or if they have any sensation of labor or something like that. Okay, so the regular checkups are very much important in the pregnancy care. And if you're practicing yoga also, you need to go for a regular checkup to make sure that everything is perfect, because there are few complications. In that complications, you can't practice few asanas, right? We'll be seeing in the further slides. And next is following the general guidelines. So whichever we learned from the last slide, no compression, no strain, and no holding their breath, and no heating pranayamas. These are the 3 main guidelines you need to follow, and thoroughly understanding the complications of the pregnancy. The pregnant lady has to know what are the complications, and like, for example, if the women who's more tense or who's more anxious are more prone to get preeclampsia. Preeclampsia is a increase in blood pressure in the pregnancy women. So they are more prone to that. So they need to know, if I get anxious, I will get this, so that they will try to calm down themselves, right? And next is take a help from a nutritionist on a prenatal diet. So you need to have a good prenatal diet, because you're growing a baby inside. So some people might tell you need to eat for 2 because for yourself and the baby, but I would tell you, you need to eat for yourself if you're growing a baby inside, because the baby will anyway get the nutrients from you. For example, if the baby's calcium level is low, the baby will get the calcium from you, your bones. It will get absorbing, it will get taking your calcium from your bones actually, so that you will be deficient in calcium. So anyway, the baby will be getting all the nutrients from yourself. So first, I'll tell you, the pregnant lady has to eat for herself, so that the baby will take care of its own. Okay, so that thing you need to follow, and you need to have a proper prenatal diet, because you need to have iron-rich food, calcium-rich food. So you need to have a proper diet for the pregnant ladies. And next, we are moving on to the yoga for first trimester of pregnancy. So first trimester is the first 3 months of the pregnancy, and you need to focus on building strength and encouraging rest mainly, because we are not going for any strenuous activity here. We need to encourage the patient to rest a lot, and you need to build strength. So we'll see what are the things you need to practice in the first trimester. So these are the list, and these are the protocol for the first 3 months of pregnancy. The first one is simple breathing exercises. You can go for just inhalation and exhalation, a very, very simple breathing exercise only. Okay. And the second thing is you're going for a pranayama practices, and we'll see in the later slides what are the simple breathing we can practice, what are all the pranayama practices we can practice. I'm just telling you the protocol now. Pranayama, in the sense, we can go for Nadi Shodhana, Brahmari, Ujjayi, Shitali, Shitkari, not heating pranayamas. We are going to completely avoid the heating pranayamas like Kapalpati, Bastrika, Surya Bedana, Surya Aniloma. Everything is contraindicated here. And next, the third one is Yoga Nidra. You can go for Yoga Nidra because the women has to relax themselves. Sometimes they might not get sleep. Sometimes they might get sleep, but they can't relax because of the discomfort they are feeling. So you can give them a yoga nidra audio to go for a deeper relaxation and all. And mainly the women should go for meditation. Meditation in the sense, it's not like forced meditation. If the patient want to do meditate, they can do. You should not force them like you need to sit in this place and meditate for 2 minutes. No. If the women is comfortable, if they are in the comfort, they can go for the meditation. And the next one is Vamana Dauti. Vamana Dauti is that you need to drink a lot of some 8 to 10 glasses of salt water, and you need to vomit. So this will be very good for the pregnant ladies during the first trimester, because in first trimester they might have a lot of nauseating and vomiting kind of sensation. So once they go for Vamana Dauti, they'll feel more relief, because before practicing Vamana Dauti, they might get the nausea sensation because of some cooking smell, something like that. So when their stomach is completely emptied out, they might be relieved from that symptom. Okay, so that you're going to practice Vamana Dauti. And next one is Mula Bandha. So Mula Bandha is something that you're going to contract and relax your vaginal muscles, so which we'll be learning in the further slides. So this is very good in the first trimester, because to strengthen your pelvic floor muscles, so that it has to hold a baby, right? So the pelvic floor muscles will be so much strengthened when you go for the Mula Bandha practice. And the next one is chantings. So chanting in the sense, you can go for a few chantings, but it should not be more than 2 minutes or something like that, because chanting also increases heat in your body. So make sure you go for chanting for some 5 to 10 counts, something like that, to just relax your mind, to just go into a thoughtless state of mind. You can go for the chanting, and not more than that. Okay. And the next one is practice under supervision. So this is very, very important step in the first trimester, because you can't go. So you can see the protocol here. I have not included any asana, any stretching kind of thing, because the first trimester is the stage where the embryo has to be implanted. It should get good circulation and all. So when you go for hip opening asanas here, it won't work out. The embryo will not get implanted into the uterus. So the first trimester is a completely relaxation, rest kind of thing. You can go for practicing of breathing exercises, meditation, yoga nidra, and mainly no squat and no pelvic opening asanas here. That you need to keep in mind. And next we're moving on to the second trimester, that is 4th to 6th month. So after the second trimester, the nausea symptom and many more symptoms from the first trimester will be reduced in the second trimester. The second trimester also, the women will be getting adjusted to her lifestyle. Like before first trimester will be easy to adjust, right? Because it is very new for them. And in second trimester, they will be almost ready to practice asana. So we can go for more of hip opening asanas, squatting, and balancing asanas. Balancing asanas in the sense vrikshasana and all we can give, but make sure you're giving all the balancing asanas with the support of the wall. They can't practice without the support of the wall, because there are so many chances they can fall, because the balance won't be proper, right? Already in normal person only, the balance will be a little irregular. They are carrying a baby in their tummy, right? So the balancing poses will be a bit difficult, but they have to practice those things with the support of the wall. And leg raising asanas can be practiced against the wall to reduce the pedal edema, to reduce the varicose veins, because pregnant women are more prone to develop varicose veins and all. So they can go for the practice of leg raising against the wall, not directly. And also while leg raising against the wall, they need to keep their knees bent. Then only they need to raise against the wall. They can't directly raise it from down. Okay, that will also put a lot of pressure in their abdomen. We remember, right? The guidelines are you should not put more pressure in your abdominal muscles, because that may cause abdominal contraction sometimes. And you need to stretch your calf muscle, because the calf muscle stretch will give you a backward flow of blood that helps you to reduce pedal edema and varicose veins, as we said. And pranayama, the same thing. You need to go for relaxing pranayamas here, not heating. Only cooling pranayama should be practiced. And here we are going for Mula Bandha and Ashwini Mudra. So these two, actually Mula Bandha, in Mula Bandha, I'll tell you the procedure. Mula Bandha is a tightening and closing of the vaginal muscles. Vaginal muscles in the sense which you can feel outside. And the Ashwini Mudra is the sense tightening and contracting of the anal muscles. Okay. Anal in the sense only outside which you can feel. That only you're going to contract and relax. So while practicing this Mula Bandha, it will strengthen your vaginal muscles and it will also makes it flexible so that during delivery it will be very easy. And Ashwini Mudra, why you need to practice Ashwini Mudra in the sense there will be a lot of pressure in their anal muscles, and some women also tend to produce hemorrhoids during their pregnancy. So because of that, because of that only they need to go for the practice of Ashwini Mudra, and also they need to avoid more heating kind of foods so that it will be the hemorrhoid formation of hemorrhoids will be more easy when you go for heating food, heat producing foods and all. And the next one is meditation and visualization. Meditation is very important during this stage because they need to, meditation is all about self-awareness, right? So they need to be aware what's happening in their body. So they need to sit for some time and go for meditation. Meditation in the sense, not just simply sitting, they can go for music meditation and whichever is very comforting for them, the like how they can go. And the next one is visualization. So they need to visualize the child which is inside the womb. Okay, they can keep their hands, they can see the movements. They need to visualize the baby, like how it is inside, how it is staying inside, and like whether the baby is happy. They can visualize the baby is so happy there, the baby is enjoying, stay there. Like you need to make sure like that. So that is the visualization that will help the mother to be like in a peaceful state. Okay, and next we are moving on to third trimester, that is 7 to 9 months. So in third trimester, we are going to practice more of standing asanas, more of balancing asanas, and more and of hip openers we are going to practice, because third trimester is the stage where we are going to prepare the mother for the delivery, right? So we need to go for more of hip opening asanas. And the next one is again the same pranayama and meditation you need to go for, and relaxation procedures. The relaxation in the sense, mainly you need to go for a yoga nidra kind of thing and all. And we'll move on to the next slide. So next is the complications you'll be facing during the pregnancy. So these are the complications, and these are the some of the complications. There are many more complications added. So these are the most important one. And first one is bleeding. So for some people, bleeding might happen. So for those people, they need to avoid squatting exercises and all the hip opening exercises. Okay, and also they need to avoid asanas till 16th week. Then they can slowly go into asanas, and after the third trimester only they can go for all the hip opening asanas and all. And in breathlessness, you need to avoid supine pose. Okay, because that will be compressing their arteries and all, so that the blood supply will be less, and so they might feel breathlessness when they sleep in supine pose. And in breech baby, you need to not practice squatting mainly, because breech baby is where the baby's buttocks is in the pelvic floor and the head is at the top. Actually, the head should be down and the baby's buttocks should be up, right? But here in breech baby, the buttocks will be down and the head is in the top. So when you go for squatting and something, it will it will go for pelvic opening when you go for squatting and all, right, during those poses. And for breech baby, there is a particular asana which works wonders, that is known as Kandrasana. We'll see in the further slides. So it is Kandrasana is actually a variation of Setubandhasana. So when you go for a regular practice of Kandrasana, the baby position will change by itself, so that the breech baby will be changed into a normal baby. Cephalic position, it will come into cephalic position when we go for the practice of Kandrasana. And the normal women should not go for Kandrasana, because the Kandrasana should be practiced only if the person has a breech baby. Okay. And next is the carpal tunnel syndrome. I told you, right, the baby will be taking so much calcium if it is not getting enough calcium, and the mother will be deficient in calcium. So at that time, the mother might feel very weak in the carpal tunnel. This is a carpal tunnel, and they might get carpal tunnel syndrome. So during that carpal tunnel syndrome, we need to reduce the pressure here. So whichever asana is giving more pressure in the wrist joint, they should avoid those asanas and all. And next is a cervical stitch. So cervical stitch is the sense where they wear something the cervical material, they will ligate the cervix after that. So during those periods also the person should not go for squatting or any hip opening asanas. And the next is low back pain. So low back pain is usually common. They should not go for any strong asana. They should just stretch their low back muscles. That's all. And in hemorrhoids also you need to avoid squatting. And in hemorrhoids mainly you need to avoid heat producing foods and heating pranayamas. You need to make your body calm, and you can go for the practice of Ashwini Mudra. And next is preeclampsia. Preeclampsia is a state where the person might go to the person's blood pressure might spike out in preeclampsia in pregnancy. And during those period, the women should not go for forward bending asanas like downward dog, Adho Mukha Svanasana, and any kind of inversion and any kind of forward bending asanas they need to avoid during preeclampsia. And placenta previa is a condition where the placenta is implanted in the lower portion of your uterine segment. So in those cases also you need to avoid opening of your hip joint, opening of the opening hip opening asanas or squatting and all. And in pelvic pain, it is also known as pelvic girdle pain. We call it as PGP. So in those cases, you should avoid wide-legged asanas, and that will put more pressure on your pelvic region, right? Wide-legged asanas, squatting, and Malasana and all you need to avoid. So these are the complications here. These are the main complications. And next we are moving on to the asanas. So then first we are moving on to standing asanas. In standing asanas, we are practicing. First is Tadasana. These are the main common general asanas which you can practice in standing. They can go for Tadasana. Tadasana is also known as palm tree pose, which they can practice by the side of their wall, and they should have a wall support. So while practicing this asana, they tend to stretch their body muscles, and it will be helpful when you go for a body muscle stretch and all. They will get some kind of satisfaction, and stress and anxiety will reduce when you go for these kind of body stretches and all. So first one is Tadasana, and the second one is Triyak Tadasana. Triyak Tadasana is from Tadasana, you're going to move towards right and left. And the middle one is Chakki Talalasana. And the next one is right angle stretched with the wall support. So this is a right angle stretch with the wall support. This only till this they can practice. They can't go down, and they can't go down till the leg. Okay. So while practicing this, if the person has a low back ache, if they have they might have more compression on their low back because of the belly weight, right? So they can go for this stretch. It will stretch your low back muscles and also mid back muscles. That will gain you a good relaxation. And the next one is Prasarta Pada Uttanasana. It is actually a modification of Paschimottanasana. You need to have some pillows. You can have a ball, a gym ball also you can have. So this asana is mainly relaxes your spine and also your mid back and lower back. And the next one is Kaliyasana. So Kaliyasana is also known as Devi pose. So this Kaliyasana should be mainly practiced only in second and third trimester, not in first trimester. In first trimester, you can go for gentle, simple asanas, not like hip opening asanas and all. So this should be mainly practiced in second and third trimester. If you don't have any complications, which we have seen before, you should not have low back pain, cervical stitch, placenta previa. And if you don't have such complications, you can go for Kaliyasana. It is very good asana to improve more blood circulation to your uterus. It gives you more hip opening, hip stretches, and it helps you to give a good delivery, because the hip and the pelvic floor will be so much flexible, so that you will tend to go for a normal delivery when you practice this Kaliyasana. And next one is wall supported squat. You can go for squat only with the support of the wall. Either you can practice like this, otherwise you can practice like this. You can place the hands on the wall and then you can go for squats, or you can support your back on the wall and then you can go for the squat. And these are some of the standing asanas. So next we are moving on to supine asanas. So in Supinasana, the first asana is known as Matsya Asana. So I told you, right, the women should go for the relaxation, yoga nidra and all. They should not go for yoga nidra or any kind of relaxation in shavasana, because while sleeping in supine pose, they might get breathlessness and it will be very discomfortable for them. Okay, so for them, you can go for this Matsya Asana, and if you want, you can keep some pillows here below their knee, and they can go for the Matsya Asana. They can go for that sleeping pose with one leg bent, and they can go for any kind of relaxation here. And the next asana is Anantasana. It's also known as sleeping Shiva pose. So this Anantasana is very good to practice during second and third, mainly the third trimester, because it strengthens your inner thigh muscles. Because during pregnancy and normal delivery, they tend to strain their inner thigh muscles. The thigh muscles will become more weak. So you need to tone your thigh muscles, you need to tone your inner thigh muscles, and you need to tone your pelvic muscles by practicing this Anantasana. And the next asana is Ekapada Uttanasana. So by practicing this Ekapada Uttanasana, you will help to reduce the pedal edema, varicose vein, so that there will be a backflow blood to your body. So this is Ekapada Uttanasana. You can also go for Dvipada Uttanasana, where you can place both the legs on the wall. With the support of the wall, you can practice. And next is Ananta Balasana. It is also known as happy baby pose. So this asana is very, very good for pregnant ladies' digestion, because the digestion will be abnormal during the period of pregnancy. They can go for this asana. We are moving on to the next slide. So this asana, what we are talking about before, that is Kandrasana. So this is just a variation from Setu Bandhasana. You need to lift a little more and have an arch. So this asana is known as Kandrasana. So this asana should not be practiced by a normal pregnant women. It should be practiced only when the woman has a breech baby, so that it can turn by itself. Okay. This asana is known as Kandrasana. And next one is known as Sukta Baddha Konasana. This asana also should be practiced only during second and third trimester if they don't have any complication. You can also have a pillow under the low back area, so that you can have an arch, so that you can go into a deeper relaxation. It will be more comfortable for you when you go for the practice of Sukta Baddha Konasana. And next we are moving on to sitting asanas. In sitting asanas, we can go for all the general asanas like Vajrasana, that will help them for a good digestion. After each and every food, you can sit in Vajrasana. And next you can go for Shashankasana. Shashankasana is a asana from where from Vajrasana, you go down, bow your head down and then relax. So for pregnant lady, it will be more difficult, so that you can spread your knees apart and then you can go down, rest your belly on the floor. Otherwise, you can have a pillow there and you can go down and relax in Shashankasana. Shashankasana also comes under another relaxation pose. And this asana, Shashankasana, should not be practiced if the patient has a pre-eclamptic state, because it may tend to increase their blood pressure if they go for forward bending asanas and all. Instead, they can go for leg raising asanas if they have pre-eclampsia. And here the asana, which is a modification of Shashankasana, is known as Uttana Shishonasana. Its asana name is also known as puppy pose, where from Shashankasana you need to lift your hip up. So while lifting your hip up, your pelvic muscles will also get opened up, and you have to spread your knees a little here. And also, if you want, you can have a pillow here in between your hands and your face, and you can rest it on the pillow. You can keep your elbows bent like this also in this pose. So this pose name is known as Uttana Shishonasana. And next we are moving on to Gomukasana. Everybody knows this Gomukasana because it helps in the improvement of lung capacity of the patient, because they tend to go for a more anxious state in the period. So when you go for this asana, it opens up your lung. When you breathe deeply, you go for a deeper breathing, deeper inhalation and exhalation, so that it helps to maintain a good blood supply and oxygen supply in the mother. And remember, you should not hold any breath in any asana. Okay, you should not hold your breath in any asana. Just keep breathing. Okay. And next is Kapotasana. This is also known as pigeon stretch, pigeon pose. So this pigeon pose is very good to relieve your thigh stiffness. So you might have thigh stiffness during the practice of during pregnancy mainly. So when you go for the Kapotasana pigeon stretch, it will relieve the inner thigh stretch and it will also open up your pelvic region when you go for this. This is also an hip openers. And you can practice this during your second and third trimester, not in first. And next is known as Chakki Talalasana, which is my favorite asana. You need to spread your legs and you need to go for a circle, bend forward and bending forward and coming backward. You need to go for a circle with your hands. And if the patient has a low back pain, this is the best asana to relieve their low back pain. It relaxes their low back muscles. And also they will have hip opening and the pelvic muscles will get strengthened when you go for the practice of this. So all these things should be practiced only in the third trimester. These are to induce your delivery. And the next is Baddha Konasana. As we know, Baddha Konasana is the most famous asana in the pregnancy. Baddha Konasana is also known as butterfly pose. Okay. And you can practice this Baddha Konasana. You can lie down in Baddha Konasana as Supta Baddha Konasana also. This will help you to relieve any kind of pain in your pelvic region. It will help you to open up your pelvic region. It will strengthen your pelvic floor muscles. And the next one is Malasana. So it will be very difficult for a mother to go for Malasana. If they practice, it will be well and good for their pelvic floor muscles. So all these asanas are very good for their pelvic floor muscles. Mainly should be practiced during the third trimester. You can have a pillow here, and otherwise you can have a yoga block or something like that, and you can go for Malasana. And in Malasana, you need to open up your thighs outwards with the help of your elbow so that you can go for a deeper stretch here. And next one is duck walk. So this duck walk should be practiced in the mainly in the third trimester. So it will help you to open up your pelvic floor muscle. It will help you to relax your pelvic floor muscles. And also this and gym ball exercise is also can be also practiced before your delivery. Like you got all the contractions and you are struggling to deliver, you can go for this duck walking and gym ball exercise. Gym ball exercise is that you have to sit on a gym ball and just keep on like giving a movement, giving a pounding like that. So that will also open up your pelvic floor muscles. And next we are moving on to pelvic floor exercise. So this pelvic floor exercises should be practiced from starting till the end. You can practice in all the three trimesters. So there are two types in the pelvic floor exercises. First one is alternate contract and relax. Second one is continuous contraction and relaxation. So we'll go for a small activity here. We'll practice this exercise here. So you need to sit straight. You can sit in any comfortable meditative pose, or otherwise you can sit in any comfortable pose, comfortable seated pose. So first one is contract and relax. In this, you're going to contract your vaginal muscles and relax. Contract and relax. Only contraction, relaxation. Contract, relax. Contract, relax. So while practicing this for around 5 to 10 counts only, you might feel there is a huge blood circulation there. And when you get more blood circulation, the muscles are more toned up and it will also improve the strength there. So this is one type. And the second type is continuous contraction relaxation is like contract, 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 and then relax, relax, relax. Again, contract, 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 relax, relax, relax. It's like a step by step you need to go. In this alternate contraction relaxation, only contraction, relaxation, contraction, relaxation. But in the continuous contraction and relaxation, you need to go for contraction for 3 counts like contract, 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 and then give a pass, then relax, relax, relax. So these two exercises will actually tone your pelvic floor muscles so that before conception also it will help a women to go for a easy intercourse. And next we are moving on to pranayamas here. So first we are moving on to a basic abdominal breathing. So basic abdominal breathing in the sense one hand you can place it on the chest, one hand on the abdomen, and you can go for just inhalation and exhalation. Just observe the changes taking place in your body. Like be aware of the breath, be aware of the movements of your abdomen, be aware of the movement of your chest. And when you inhale, you need to be aware of the air moving into your nose, moving into your nostrils, moving into your trachea, everything you need to feel while practicing pranayama, right? So this is the basic abdominal exercise. Second one is yogic breathing, where yogic breathing will be practicing like abdominal, chest, and clavicular breathing. So you need to place both the hands in the abdomen, go for inhalation and exhalation for 5 to 10 minutes, and then you're placing your hands in the chest, go for inhalation and exhalation for 5 to 10 rounds, and then you need to place your hands on the clavicle. And there will be upward movement of the clavicle when you go for inhalation and exhalation. These are the 3 steps in yogic breathing. This you can practice. And next is Nadi Shodhana. I hope everybody knows the practice of Nadi Shodhana. Anyway, I'll be telling you one more time. So you need to have a Nasikaga Mudra. You need to fold your index and middle finger. So in Nadi Shodhana, you need to start from left and end it in the left. So you need to inhale through left, exhale through right, and again inhale through right and exhale through left. So this is the one round of Nadi Shodhana Pranayama. So a pregnant lady should go for the practice of 20 to 30 rounds of Nadi Shodhana Pranayama during that practice. So it's not like during a normal yoga session, we go for the asanas. Asana part will, if I'm conducting a 1 hour session for a normal general public, it will be like 45 minutes of asana and 15 minutes of pranayama, right? But for pregnant ladies, it should be half. Like if you're conducting a 1 hour session, half an hour for physical asanas and half an hour for breathing, pranayama, relaxation, meditation. So it should be equal. Because pregnant ladies should concentrate more on their breathing pattern. They should be more aware of their breathing pattern and all. Okay. So next we are moving on for Ujjayi breathing. Ujjayi breathing is also known as cyclic breath. And in Ujjayi breathing, you need to take a deep breath in, have a lock here, throat lock, and you need to exhale by making a sound from your throat region, like a hissing sound you need to make. So that is Ujjayi pranayama. You can check the procedure later. And next is Brahmari pranayama. In Brahmari pranayama, you can also practice with Suji Mudra or Shanmukhi Mudra. You need to close your ear and take a deep breath in, and you need to go for a makara chanting like this. This is Brahmari pranayama. You have to go for Brahmari pranayama for around 10 to 20 counts to get a good benefit of Brahmari pranayama. And this Brahmari pranayama can also be practiced if the women is not getting sleep during night time. Before sleep also they can go for the practice of Brahmari pranayama. And the next 2 pranayamas are Shitali and Shitkari. These 2 are the cooling pranayamas. Before we saw everything was a balancing pranayama. Next is the cooling pranayama, that is Shitali and Shitkari. So first Shitali pranayama is that you need to roll your tongue into a tube like this. Inhale through your tongue and exhale through nose. So this is Shitali means you need to roll your tongue into a tube. And Shitkari means you need to roll your tongue upwards so that the root of the tongue touches the root of your mouth like this. And you need to inhale through the sides of the tongue and exhale through mouth. So this is Shitali and Shitkari. 2 important cooling pranayama should be practiced by the pregnant ladies regularly. Okay. And these are the pranayamas that they can go to the practice. And next we are moving on to mudras. So mudras has a larger impact on the practice of for the practice in the pregnant ladies. So these are the main mudras a pregnant lady should practice. It's not like in one session they need to go for all the practice of all the mudras. They can go one day, they can practice Bhairava Mudra, another they can go for the practice of Jnana Mudra and something like that. So I'll show you the mudra, how it should be practiced. The first one is Bhairava Mudra. So Bhairava Mudra should be practiced like this. You need to place one palm, upon that another palm should be placed, and your thumb should be touching your feet, and you can place this Bhairava Mudra below your abdomen, below your navel region. So this Bhairava Mudra is very helpful to improve the good circulation to your uterus. Bhairava Mudra mainly. Okay, so Bhairava Mudra is also known as Brahma Mudra, and mainly it helps you to calm down your mind, and it brings a good self-relaxation and self-awareness about yourself. This Bhairava Mudra. And the second one is Dhyana Mudra. Dhyana Mudra can be practiced like this. Same like Bhairava Mudra, but you need to both the thumbs should be touching each other in Dhyana Mudra like this. You need to place it around below your navel region. So this Bhairava Mudra and all you can practice during meditation, during pranayama, or during a basic simple breathing practice also you can go. So this is Dhyana Mudra. And third one is Jnana Mudra. Jnana Mudra is also known as Chin Mudra. You need to touch your forefinger to your thumb. So this is Jnana Mudra. You can place it facing upwards and you can place it on your knees. And next is Hridaya Mudra. Hridaya Mudra is a very, very important mudra to be practiced by a pregnant lady because it is very good for their heart health, because the heart is pumping the blood for the two people, right? So in Hridaya Mudra, you need to bend your forefinger, touch your middle finger and ring finger to your thumb, and should be practiced like this. Like this, you need to place it on your knees facing upwards. So this is known as Hridaya Mudra. One more time, I'll show you. You need to bend your forefinger and your thumb and ring finger should be touching your thumb and your little finger pointed outwards. So you need to place this on your knees. You can go practice this Hridaya Mudra when you go for any pranayama, or if you're just simply sitting and watching TV also, you can practice, adopt this mudra and practice. Okay. And next is Yoni Mudra. So Yoni Mudra is very, very, very important in pregnancy for a pregnant lady because Yoni Mudra is mainly concentrated on the uterus. So Yoni Mudra, how to practice Yoni Mudra is that you need to join all the fingers and you need to point the forefinger forward and thumb upwards like this. Okay, this should also be placed under your navel region, like it should be placed next to your uterus. One more time, the fingers joined and forefinger pointing forward, thumb pointing upward. Like this also you can practice, like this interlocking also you can practice. This Yoni Mudra. Okay, so this Yoni Mudra mainly concentrate on bringing a more and more blood circulation to your uterus. It takes care of your uterus well when you go for the practice of Yoni Mudra. Okay, and next is Sahajoli Mudra. Sahajoli Mudra is very important in a pregnant woman because post or prenatal stage also the women will be practicing. Women will be getting a symptom known as urinary incontinence. This urinary incontinence is a very uncomfortable thing for a woman because they can't tell it to others also. So they'll be struggling with that urinary incontinence because of the weak urethra urinary sphincter. So you need to tighten, you need to tone the sphincter. For this toning, you need to go for the practice of Sahajoli Mudra. What you need to do is you need to contract the urethra and release. So for better practice, you can practice it during your urinating procedure. So when you're urinating, you need to stop the urine by yourself. Like when you start urinating, the flow is coming. You need to stop in between and again flow it, make it flow. And again stop it and again make it flow. Again stop it, make it flow. Then you will get to know, this is the first time. This should be practiced only the first time. So that you will get to know what is known as urethra contraction. Okay. And then after knowing where to contract, how to contract, you can go and sit in some place and you need to contract only your urethral sphincter and relax. Urethral sphincter and relax. This will strengthen your urethral sphincter muscles and the women who are suffering from urinary incontinence will be recovered. Okay. And to avoid urinary incontinence also you can practice, and if some women has urinary incontinence also they can practice it. And the next second one is Ashwini Mudra. Ashwini Mudra is very good. This is Ashwini Mudra is contracting your anal muscles and relaxing. Anal in the sense only the outer part of your anal region. Okay. So Ashwini Mudra is very good because the women so many women might suffer from constipation, and because of a lot of pressure, they might suffer from hemorrhoids and so. So you need to give good exercise to your anal muscle, anal sphincter muscles by practicing Ashwini Mudra. You need to contract and relax and give a good relaxation there. And next one is Mula Bandha. Mula Bandha is that contracting your vaginal muscles and relaxing. Okay. So for that, you need to sit in any comfortable pose And these contraction, relaxation, and all should not be practiced while you're sitting on a cushioned chair or a bed or something like that. It should be practiced on the floor. You need to put a mat. You can have a thick mat or something like that, and you need to sit on the floor and you need to practice. So Mula Bandha is tightening and relaxing your vaginal muscles as we did in the pelvic floor exercises. So this helps in toning your pelvic floor exercises. It strengthens your pelvic floor exercises and everything. Okay, so these are the pranayamas. I'll practice it one more time. So Bhairava Mudra is you need to place one finger upon the other. This is Bhairava Mudra, also known as Brahma Mudra. Dhyana Mudra should be practiced by joining both the thumb, and Jnana Mudra is joining your index and middle finger. So these three pranayamas are mainly related to your mind. It helps in giving you a good mental health when you go for the practice of these mudra. And the next one is Hridaya Mudra. Hridaya Mudra, bend your forefinger, touch your middle finger and ring finger to your thumb, and you need to place it like this. The Hridaya Mudra should be facing upwards. It can be placed on your knees. Okay, it's very good for your heart health. And next one is Yoni Mudra. The forefinger will be pointing to away from you, and the thumb will be facing upwards, and you can also interlock your hands and you can place it. So this Yoni Mudra is very, very good for the pregnant women to strengthen their uterus. So this Yoni Mudra can also be practiced by people who has any gynec issues, like who's suffering from any endometriosis, PCOD, irregular periods, any kind of gynec issues. They can go for this practice because that helps in giving good blood supply to your uterus and to your the reproductive system of a female. And the next one is Sahajoli Mudra. Sahajoli is contracting and relaxing of your urethra. So this will prevent a lady from a urinary incontinence. So if any other women apart from pregnant lady in your home has urinary incontinence, it mainly happens during old age. So you can teach them this urinary, Sahajoli Mudra by contracting and relaxing the urethra. So the first time when you teach them, you need to teach them like when they are passing urine, they need to stop and flow, stop and flow. That thing you need to inform them, the information you need to give. Then they'll get to know where to contract and relax after that, right? So next is Ashwini Mudra. Ashwini Mudra is contracting anal muscles and relaxation that helps in prevention of constipation and hemorrhoids and all, and hemorrhoids, fissures, everything. And next one is Mula Bandha, is contracting vaginal muscles, like you're contracting pelvic floor exercise, like contracting your pelvic floor muscles and relaxing. So these are the mudras that can be practiced during pregnancy. And next we are moving on to Kriyas. Kriyas are also known as cleansing technique. So in Kriyas, so first we are going to practice Trataka. So Trataka is something where you put your more energy and where you go for a deeper concentration and all. So this will help the women to remove their suppressed emotions. Okay, in Trataka, there are two types of Trataka. That is Bindu Trataka and Jyoti Trataka. So Bindu Trataka is that you can have a blank space, and you can keep, if you have a whiteboard, you can keep a black dot in that, and you just have to concentrate on a single point. So that is Bindu Trataka. And next one is Jyoti, is that you need to practice Trataka with the candle light, right? So that is Jyoti Trataka. So this Trataka mainly removes the emotions, like suppressed emotions from the lady. So that will help in improving their emotional stability. So next is Jalaneti. If they can practice Jalaneti, they can practice. If they feel like it's like giving more torture to their body, don't make them practice Jalaneti. But Jalaneti will cleanse their nostrils very good. They will not have any allergic reactions when they go for Jalaneti, because it will desensitize the nostrils, right? So they can go for that. And Vamana Dauti should be practiced only in the first trimester. When they have any nauseating or vomiting kind of sensation, they can go for this Vamana Dauti. Vamana Dauti is that you need to drink a lot of water, like 8 to 9 glasses of salt water continuously, and you need to vomit it out. And then you will have a better feeling after the vomiting sensation, and you will feel better. The nausea sensation and everything will reduce. And when you practice all these cleansing techniques, make sure you don't have any spicy food after that. You need to have something blunt. A blunt diet should be there. with less salt and less spice added to it. And then you can go for the practice of Laghu Shankha Prakshanana. So mainly pregnant women have constipation. They tend to put more pressure during passing motion. So that will help them to develop fissures, hemorrhoids, and sometimes they might also have some kind of prolapse and all. So to avoid that, to ease your motion and to cleanse your old toxins and all, you can practice this Laghu Shankha Prakshanana. Shankha Prakshanana is a big procedure. It's like you need to drink more water, but Laghu Shankha Prakshanana, you can go for 2 liters of water. Take 2 liters of boiling water, add 2 teaspoons of salt, and squeeze some lemon, and then you have to drink some water, and you need to go for a set of asana practice here, and then you need to pass motion. That is Laghu Shankha Prakshanana. That is a very long procedure here. And a pregnant woman can go for the practice, and make sure before going into any kind of practice or any kind of kriya, pranayama, make sure you take advice from your physician. Otherwise, if you have any yoga instructor or if you have any yoga physician, go to them, like tell them you need to practice this, so they will guide you. You should not practice anything on your own at home, because something has contraindication, something has indication, the thing will differ, right? So everything, each and every asana or pranayama, or even you're going for kriya, each and everything should be practiced under a guideline, practiced under a practitioner, a physician. You should not do it by yourself at home. Okay. And so that's all for the class. So I hope you all learned what are the asanas to be practiced here and what are the guidelines and everything. So if you have any doubts, you can just put it there. And yes, thank you.
Thank you so much, doctor. That session was very good in the sense because we have covered so many things in that. So I have 2 questions with you. So first question would be, what are the challenges do you face during these kind of yoga therapy while you introduce to the patients, because they feel the yoga we cannot do, exercise we cannot do during pregnancy. So how do you deal with these kind of problems?
Yeah, actually, first we need to check whether the woman is already a yoga practitioner or she is new to the yoga session. Because if she is new, we need to start from the basic. We need to start from, I can't directly go to the asanas which I showed in the slide, right? I need to start from loosening exercises and little more stretches, and slowly I need to improve. And if a woman has already been practicing yoga, her body muscles and everything will be different. And so that I can directly go to few loosening exercises, and I can directly go to the asanas and everything and all. And the challenges I face is that it might be difficult for them. Some women might not feel comfort in a comfort zone. Okay, so if some asana is very easy, but we think it's very easy, but that is not easy for them. We need to think from their side point of view, because they are already in under pressure, right? They're already growing a baby. They might be having so many stresses from their home side and everything. So everything we need to look into, and we need to plan a protocol. It's not like for all the women we have only this protocol. Whichever I showed, it's like I have showed you in first trimester, second trimester, third trimester. It's not like you need to practice. First trimester means okay, I need to practice only these set of asanas. It's not like that. You need to check the patients whether they are comfortable in asanas, whether they are comfortable. We need to go into their comfort zone, and then we should teach. And also we need to make the session interesting. They need to ask about themselves, how they feel, and something like that. We need to connect to them. Okay, so then we need to ask their problems. What are the problems they are facing, and we need to think the solutions for that. We need to make themselves comfortable. So that's what I do.
And how do you deal with the challenges when we see as a student in the BNYS, like how do we train ourselves in these kind of training? How do you train yourself, and how we should learn, our learning, how it should be?
Our learning, in a sense, you need to go, you need to start taking, first you need to be perfect in normal yoga classes, and then we need to go visit few yoga centers. I have visited few yoga centers, few maternity yoga centers, and then actually I learned a few from themselves. like a few from, I didn't learn from only one person, I learned from each and every one. So everyone will teach something, right? So I learned from here and there, and then we need to make a protocol, and then I learned it like that. So starting, you can first you need to understand the person, you need to read the person, then only we can give. So it's not like it doesn't work on a protocol actually. So if the person is comfortable, then only you can go for the practice of that asanas or something like that.
So definitely our system work as a personalized medicine rather than generalized medicine. With this approach, do you like to give any end message to each and every student who is going to watch this?
Yeah, I want to give them, you need to have more exposure, but for naturopathy and yoga and all, for some pregnant people and all, they don't prefer that, right? Because they might be scared, and some might refer gym. Some who is going to gym, they might know few things about yoga, and they think, okay, before I was practicing gym, now I'll let me try yoga, like that they will go. But some are more scared to practice yoga during the pregnancy. We need to convince the patient. So for convincing the patients, we need to have more patience. So we can't think like, if I want this, I have to do this. No, you need to have more patience. And this is my learning stage now. Now I'm not a perfect physician and all. I'm also learning day by day. So every day is a learning day, right? So you need to learn each and every day whatever the patients teach. So I'm actually learning every day something new from my patients only. So you need to explore more, you need to see more patients, then you will learn better. That's my thing.
Thank you so much to come on our platform for sharing all the information from start to end. And it is enlightening for all of us as you have covered how the thing should be, what are the contraindication, what are the indication, and how it should be used in your clinical practice, because that's the most important part of our journey. So thank you so much, Dr. Shweta, to come on our platform and share your journey with all of us.
Welcome, and thank you for introducing me here, and thank you so much, sir.